Welcome. My name is Boris. I'm the chief here at Nemours Children's Hospital in the Behavioral Health Division. And I'm really pleased to be able to talk to you about something that I'm quite passionate about, the effects of trauma on young children. And I thought the way we would do this is to look at this issue in three different parts. It's a complex issue. It's an issue that I know many of you deal with in your daily work. And it's one that I want very much to think about with you as we go forward in our work together here in Florida. Before I get into the talk itself, I want to make some acknowledgements to a number of different people who have been very supportive in getting this series of lectures together. First of all, Secretary and Mrs. Wilkins, who invited me to Tallahassee recently to talk about issues including trauma in young children. Peter DeGree, who works also at DCF in Tallahassee and has been a very big supporter. Carol Schaffer with the Youth Law Center in California. The Center for Child Welfare at the University of South Florida. And that's a group that's been terrific in helping put this together. Of course, my own home team here at Nemours, the Nemours Foundation and our Children's Hospital. My colleagues at the Florida Association for Infant Mental Health, with whom I'll be doing much more work as we go forward. And my colleagues from Tulane University and our Institute for Infant and Early Childhood Mental Health. So I know it's a long list of folks to acknowledge, but I really feel very pleased to have so much support in this work. I also am pleased to announce to those of you who don't know that not only am I father of two, I'm now a father of three. This is my latest addition to the family, little Anderson Maxwell. We named him Maxwell because my wife and I have reached our max at number 3. And this is a photo taken by my wife of little Anderson not long ago. He's now 5 months old. You can tell she's not a first-time mom by this photo, because anybody who has time to stage a photo like this is clearly feeling relaxed as a parent. But the importance of infants in our society, in our lives, for us who do clinical work, is really something that I've had a lot of passion about as time goes on. So I dedicate my talk today to my little guy, Max. So the first part of this three-part series is what I call thinking big about the little ones. The picture you see here is of the Nemours Children's Hospital. I'm in the auditorium now at this very facility. It's a magical place, really. If you ever are in Orlando, please stop by and visit us here. And I use this picture because the folks who put this hospital together thought big about pediatric care. They had a vision. They worked on it for years and years. It came to fruition as a state-of-the-art facility, and I'm very, very proud to be part of the team here. I also thought I would put together a saying for today. This comes from the anthropologist Margaret Mead, who did so much interesting work back in the decade when I was born, let's say a few years ago. And one of the things that she said that I really think about a lot is this quote: "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." Now, I brought in Margaret Mead as someone for us to all think about, and now I'm bringing in a second amazing person to join us in this talk today, and that's James Heckman. Heckman is a Nobel Prize-winning economist who developed what he called a unified approach to human development. His interest as an economist, of course, is with big topics like health and employment and the like. But what he's also been interested in is what are the roots of things like educational achievement and the like, and how do we as a society make sure that we grow those roots strong. And in fact, his work has led to the Nobel Prize because he has integrated findings across fields. I'm not going to say much more about it because I think we ought to have Heckman himself join us today And so I'd like you to watch this next video clip, which is a presentation he did at the Chautauqua Institute in 2009. And I think it's a powerful testimony to his theory.
Forward TV, the world is thinking.
And so I want to try to use this concept of multiple skills, the technology of skill formation, to organize a large body of evidence and to suggest how it is we can improve American society. So let me summarize some main points and then try to establish these points. The first point I would make is, as I said already, that many major economic and social problems, when we start to analyze them, like crime, teenage pregnancy, dropping out of high school, adverse health conditions, can be traced to low levels of skill and ability in the society. It's not to say that these factors are the only factors causing these problems, but we know that they're major contributors, and recent research has shown this in a decisive way. And secondly, and crucial to this discussion today, is that we have to recognize the multiplicity of abilities. Current public policy discussion in the United States in particular, but not just in the United States, focuses on promoting and measuring cognitive ability through IQ and achievement tests. For example, a great deal of fuss has been made about the No Child Left Behind Act. That concentrates attention on achievement test scores, measured primarily in the 4th grade, and not looking at the whole dimension of human development, not evaluating a range of other factors that promote success in school and life. Now, there's no doubt that these factors are important. The ability to read, the ability to solve problems, analytical problems, very, very important. But what we've also learned, and this is extremely important, is that these socio-emotional skills, as well as physical and mental health, things that are called soft skills in popular parlance, perseverance, attention, motivation, and self-confidence, they contribute enormously to society, to success in society at large. And ironically, they actually even determine the scores on the tests that we use to monitor cognitive achievement. And so what we have come to understand is we've come to understand through work in psychology and work in economics that these socio-emotional skills are as predictive, and in many cases more predictive, depends on the task, for adult success. Now, the other thing that's very worrisome in this dimension, though, is that ability gaps, whether in cognitive skills or whether in non-cognitive skills, between the advantaged and the disadvantaged, open up very early in the lives of children. And we've also come to understand that the family and family environments are playing major roles in producing both cognitive and social-emotional abilities. Schools don't function without successful families. Families play a critical role, and a role that's frequently neglected when we think about social policy. And why should we be concerned about this? Well, I think we should be concerned because the family environments, as we properly measure parenting and we properly measure the resources that we put into our children, that family environments have deteriorated in the US, the United Kingdom, and many countries around the world. But the news is not all bad. We have experimental evidence and evidence from a number of studies that are carefully documented, not just in human beings, but even in animal populations and other populations where we can actually study the process of development, parallel processes anyway. That experimental evidence shows that early interventions in disadvantaged families can contribute in a very positive way towards alleviating disadvantage and towards eliminating some of the consequences of the accident of birth that places some families, some children in advantaged families and other children in disadvantaged families. And what we've learned, and this is the positive message I want to share with you today, is that if society intervenes early enough, it can raise cognitive and social emotional abilities. And the rates of return on these investments, if we put it in a purely economic setting, range between 7 to 10%. As a benchmark, the historical return on equity, never mind the recent 6 months of the stock market, the historical return on equity is about 5.8%. So what we're dealing with is a rate of return on investment that essentially is very high, that competes with any social program, that's much better than infrastructure, much better than building bridges, much better than fixing potholes. Fixing people, creating a base for future productivity and motivation for the society has a very high economic and social return. And the positive news is that we can do something about our social problems.
So, the fundamental principles here that Heckman laid out are really important. So I want to go through his central argument in a little bit more detail because I think it's critical to our understanding of the big picture here. First, he says behaviors are shaped by abilities, by motivations, and he talks about how, as you just heard, these traits emerge early in life. And that's a critical concept. He says that not only do they emerge early in life, but they're influenced by family relationships. And you heard him talk about the importance of family relationships in developing what he calls non-cognitive skills. So we've got things like conscientiousness, we've got self-regulation, we've got motivation. All those things, as he argues, are important in kids' achievement even on standardized tests that we give them in 4th grade, 7th grade, etc. Now, not only that, not only are these non-cognitive skills related to educational outcomes, they're really related to what he calls health capital. Only an economist could come up with a term like health capital, but it makes sense to me because he's saying, in fact, that as we understand data on early relationships and how they influence young children, we're really looking at how people make decisions about everything, including their own health. So what we have here is a health policy argument, and that he argues quite strongly that we haven't invested enough in early intervention, that our policies in the US need to shift to an understanding of this unified developmental approach. Now, we might ask ourselves a couple of important questions, right? First of all, if social and emotional development is so key in learning and in health, then what are the things that hinder social and emotional development in early childhood? Obviously, the flip side of that question, what are the keys to promoting social and emotional development in young children? Equally important. And so we're going to delve a little bit more into this today because I think these are indeed big questions. I titled this slide "The Widening Gap" because, as you heard Heckman say, what's most troubling in our society in some ways is the gap between different components of the society, different peoples. And that gap really is about social and emotional capacity. Now, I'm going to turn to a key set of studies to further Heckman's arguments. And these are the adverse childhood experiences studies. They're really a phenomenal group of papers written from a large-scale study of some 18,000 participants, which was carried out mostly on the west coast of the US by the Kaiser Permanente group. It's interesting because this crew is really a managed care organization. They're interested in promoting health. They insure people and treat their illnesses. And so an internist named Vincent Felitti and a larger group of people began to try and understand what the predictors of health outcomes in adults might be. They had a large group of participants and a large group of medical records to look at. And so they said, you know, we're going to look at early adverse experiences happening in childhood. We're going to have our clients, our patients, take a survey. It's going to be quite simple in nature. We're going to ask them, did they experience any type of maltreatment as a young child? We're going to ask them about psychological, about physical, about sexual abuse. We're also going to ask about household factors like substance use among a caregiver, or mental illness, or someone in the home being imprisoned. Is there violence in the home? this really set of 7 original risks were looked at. And really the question was very simple. Okay, let's map these risks onto an all-star list of health indicators. Smoking, obesity, alcoholism, drug use, history of STDs, suicide attempts. Things that are costly, things that have high morbidity and mortality, and things that are preventable in large measure. So the question for the Adverse Childhood Experiences study boils down to a very simple one. How does exposure to adverse childhood experiences relate to all these major health indicators? Now, Heckman talked about this in the video you just saw, although he didn't go into any detail with regard to this study, but he talked about adverse experiences happening in childhood. And he's really pinning this set of studies onto his theory. What the researchers found was something rather dramatic. Perhaps not surprising when we think about it, although in a moment we'll tuck into some of the more surprise findings. But when you take something like attempted suicide and you map that onto adverse childhood experiences, it's probably not going to surprise anyone that once you get up above 3 or 4 of these experiences, the relative risk for attempting suicide increases dramatically, as is indicated in this slide. Again, not a large surprise for those of us who are in mental health and treat these conditions. But to see it so starkly laid out in stepwise fashion was new, and in fact quite powerful. Furthermore, the magnitude of effects here, where 0 ACE scores compared to 4+ had something approaching a 20-fold difference in risk. That's very powerful. And it turned out when you looked at all of the different health conditions that they were able to map from the adults' medical records, you again saw this collection of stepwise increases. As adverse childhood experiences increased, so too did negative outcomes. Now, not the same magnitude for each problem. So you see toward the top, for instance, suicide and injection drug abuse. Again, perhaps not surprising. But if you even look down at the lower part of the slide, and here we're talking about conditions like cancer. We're talking about obesity. And we're looking at a relative doubling in risk. Not 19 times, but 100% higher likelihood to develop these conditions. Then we can see that that's almost as dramatic a finding, because we hadn't thought that cancer, for instance, could be considered to be a psychosocially based disease process. Now, we probably don't have time to go into research that's beginning to fill in our understanding about these relationships in today's discussion. But I will tell you that this is a pretty remarkable set of studies and findings. And in summary, when you look at the ACE studies, you learn, first of all, that there is this strong relationship between adverse childhood experiences and health risks. You learn that these experiences are common in the population. Now, as you probably have sorted out, Kaiser Permanente is an insurance group. These are not uninsured individuals. It's not the bottom strata of the socioeconomic ladder we're talking about here. And so we're really looking at common experiences across the population. The conclusion from this ACE studies was that, in fact, ACEs are among the leading determinants of the health and social well-being of our nation. And this is part of what Heckman's argument is, that we've got to get in early and support young children and families. Now, those of us who are physicians and other medical workers, we feel good. In some ways, this keeps us in business, right? But clearly, the challenge here is how do we as a society address these issues and improve the health of the people. Now, what Felitti and his team did was come up with actually a very simple model that's diagrammed here with regard to sort of the pathway between adverse childhood experiences at the bottom and early death toward the top. And you can understand that, in effect, children who've experienced adverse childhood experiences end up having social, emotional, and cognitive impairment. And this, again, is what Heckman is talking about. The importance of positive social emotional development in early childhood, not for its own sake, but because of its relationship to overall health across the lifespan. We would like, of course, to be rid of adverse childhood experiences, to prevent them completely. This is indeed a large-scale, complex task, not an easy thing to do. So often, people in my position end up having to work with young children who've already developed these impairments. And that's another part of why I'm standing here today, is to suggest that we can identify these kids even at ages 2 and 3 and begin to intervene to stop this cascade or this process, this pyramid, from developing further. Now, I want you to watch this entertaining video, because if you think about Heckman's discussion of soft skills, non-cognitive skills, for many people it's a little bit hard to put your mind around it. Walter Mischel did an amazing study many years ago called the Marshmallow Test. And this video here will let us all view children taking the infamous Marshmallow Test. Enjoy.
Okay, sit in that chair. All right, here's the deal. Marshmallow for you. You can either wait, and I'll give you another one if you wait, or you can eat it now. When I come back, I'll give you another one, so then you'll have two. But stay in here and stay in the chair till I come back, okay? All right. I'm gonna go do something and then I'll come back.
It smells yummy. It smells really good.
It's up to you. You can have it now or you can wait. Okay? I'll be back. Stay in the chair, okay? Okay. All right, so I'm gonna leave and then I'll come back, okay? So you can either eat it right now or you can wait. Either way, okay? Okay. How'd you do? Did you do good? You did? Yeah. You wanted to eat it, didn't you? Yeah. So did I tell you to give you another one? Okay, now you can have both. You need them.
Now, when we think about that video and we think about how cute that little girl was who ate the marshmallow, couldn't wait for the second one, and how hard a lot of those kids tried to delay gratification, you may wonder why my next slide talks about young children in foster care and victimization. And it's really because what we've understood about things like the capacity to delay gratification is that in fact it's related to one's early experiences. You don't learn this de novo. Now there's nature and nurture and there's interplay for sure. But what we face in America and in other developed nations around the world is lots of children, preschool aged, younger even than those in the Marshmallow video, who've been maltreated. Now these data are from 2005. If you look at more recent data, they haven't changed at all. The only thing that's changed is ACF doesn't provide you with nice, clean slides like this anymore. So the victimization rates are very similar at this point in time. And you see children from less than 1 to 3 up here at the top of the slide being the most likely to be maltreated in the country. And the most likely also to be placed in foster care. Here in Florida, as in Louisiana, where I came from, more than 50% of kids coming into foster care are preschool-age children. So, of the 500,000 or so U.S. children under 18 currently in care, roughly 30% are 5 and under, although that's changing very, very rapidly. And again, in many states, that's pushed up above 50%. That percentage of preschool-age children coming into foster care is rising, even at a time when overall rates of child maltreatment are thankfully going down. So the challenge here for us in this business is to find these children and provide them with the kind of services they may need. What Heckman argues is that we have to take a public health framework. We have to think about these kids from a broad perspective. That's the big picture in this first talk. And he really breaks down something fairly remarkable. Only economists can come up with formulae like this and show the data to back them up. But what he says is, look, when you look at early death in the developed world, post-vaccination, post-antibiotics, you see that, in fact, we can break down that 40% of deaths are due to what are called behavioral patterns. 30% to genetic predisposition, 15% to social circumstances, and another 10 or 15% to medical care access issues and shortfalls. Now, interestingly enough, at a time when we're arguing about how to manage health care in this country, one thing that Heckman says we really need to understand is that of the trillions of dollars we're spending on health care, we're doing it on treatment, on hospital-based medical care and outpatient care. And that this is really not a wise investment strategy. What we need is to think about prevention. So I use this quote from Heckman at the bottom of the slide. While it is possible that current resource allocation represent a social optimum, this seems unlikely. That's an economist talking, if I've ever heard one. We've got to think about preventive intervention, and we've got to think about that early in life. Now, this is another Heckman slide, and this is where you win a Nobel Prize, because you begin to break down how investments are capitalized across time. And this slide shows clearly from the collection, and you can go online to James Heckman's website and get more slides and papers on this very set of topics. But if you look at the return of investment in what he calls human capital, the things that make a difference societally, your investment early in life, particularly in the first 3 years of life, pays back far greater than waiting all the way into the teenage years or later. So if you're going to put money on the line, you ought to put money on the line early, because you're going to get a return on that investment that's much, much greater. So early trauma and the loss of human capital is a pretty powerful thing. And I'm going to argue that it's a thing we all need to attend to. So this graphic is interesting because, as Heckman argues, a loss of human capital is what we're trying to guard against. And again, if we think about preschool-age children, what preschool-age children require to develop what we would hope all children develop, which is self-regulation of their behavior and emotions, is a partner, right? What preschoolers need is someone to mutually regulate with them. And what happens for traumatized children is that they require a very sophisticated mutual regulator, one even more than anyone else, because trauma can impair mutual and self-regulation in ways that are very important. In the second talk in this series, we're going to delve into that a little bit more, because it's a central concept on how trauma itself has effects on young children and makes us think about programs that we need to develop. That program part will be the third section of our discussion today. I'm going to close this section with an update on the Marshmallow Test. Interestingly enough, though this test has been around in social psychology for 30 or 40 years, I found a recent article on Slate.com that talked about the newer versions of the Marshmallow Test. And what these studies suggest is that, and I'll quote here, the new marshmallow experiment doesn't discount the old one. Willpower, or the capacity to delay gratification, still does breed long-term success, as has been shown. But it suggests that when children are in an environment where they trust in a clear long-term gain, they are more likely to pursue that gain. And so what we understand here is that children are incredibly socially responsive even in the first years of life. They will read a social environment very carefully and make decisions about whether to wait to eat a marshmallow or not based on cues they gain from that environment. So when we talk about having a mutual regulator, but somebody who helps them understand their environment, it becomes clear how important that is. In the next talk, we'll delve further into that.